Hey everyone, it's Dr. John Schaefer, physical therapist, orthopedic specialist, and strength conditioning coach. If you have a knee surgery coming up, you might feel a mix of nerves and anticipation. One of the best ways to set yourself up for a smoother recovery is to prepare your knee before the surgery. So, in this video, I'll cover key considerations before your surgery, as well as walk you through some essentials to help you build strength and mobility beforehand. Let's go ahead and get started. The first things first, why is preoperative preparation so important? Studies show that going into surgery with a stronger, more mobile knee can lead to better post surgery outcomes. It can help reduce your recovery time, minimize pain, and improve your overall function after surgery. Think of it this way: the stronger and more prepared your knee is before surgery, the better it's going to be able to bounce back afterwards. On the other hand, if you don't properly prepare the knee for surgery, the recovery afterwards is going to be that much more challenging. You'll also want to get used to certain movements and exercises that you'll be doing during your rehab. So consider this phase as your pre-surgery training camp. We want you to condition your knee and your entire body for all the work ahead. Before we get into any kind of specific exercises, here are a few key considerations to keep in mind as you move through this process. Number one, talk to your surgeon and physical therapist. Before starting any exercise routine, always consult with a medical professional. They'll help ensure that the exercises you're doing are safe for your specific condition as well as where you're at currently. Number two, pain and swelling management. Reducing inflammation and pain is crucial. So you can apply ice regularly or use over-the-counter anti-inflammatory medications if recommended by your doctor. Managing swelling can help promote better range of motion. So if you want to ice, I would suggest icing after activity or icing towards the end of the day, as opposed to icing right away in the morning. Number three, range of motion. Improving your knee's range of motion needs to be a priority at this stage. The goal is to work towards full extension or straightening of the knee and getting as much flexion or bending of the knee as possible without pain. Next, strengthening key muscles, focusing on building strength in your quadriceps, your hamstrings, and your glutes. The stronger the muscles are around the knee, the better support you're going to have during your recovery. So, oftentimes we'll talk about the quad as an insurance policy for the knee. If the quad's nice and strong, you're going to have a lot of protection, a lot of opportunity to make up for any damage or irritation to ligaments, tendons, muscles. On the other hand, if the quad's not as strong as it needs to be, some of those issues start to become a little bit more apparent. Number five, mental preparations. You're doing a great job watching this video to kind of mentally prepare, have a little bit of an idea of what to expect here coming up. But mentally preparing for surgery is just as important as the physical prep. So understanding that recovery is a gradual process can help you set realistic expectations as well as stay motivated. Rehab is not a linear process. There's going to be times where things are going well. There's going to be days where you have little setbacks. Maybe you did too much. Maybe you're having a higher pain day. Whatever the reason may be, just know that that's part of the process. It doesn't necessarily mean you're doing anything wrong. It's just very challenging to have a perfect rehab from start to finish. Now, let's go through some exercises you can perform in the weeks leading up to your surgery. And remember, the goal here is to build strength, improve flexibility, and reduce swelling without pushing into that pain. Exercise number one that's super important is called the quad set. So you're going to sit with your leg extended in front of you and tighten the muscle on the top of your thigh by pressing the back of your knee down towards the floor. Hold this position for 5 to 10 seconds and then relax. And this is something that you can repeat for 10 to 15 repetitions. And this exercise is important because it activates your quadriceps, helping to maintain strength in the front of your thigh. And it can improve some of that knee extension too. With this exercise, this is something really you can be doing as much as every single hour. After any kind of surgery around the knee, the quad muscle likes to shut off. So this is something you'll be doing after your surgery as well to try and get that muscle to turn back on. The next exercise is called the straight leg raise. So for this exercise, you'll lie on your back with one leg bent and the other leg straight. Tighten your thigh muscle and slowly lift the straight leg up about 12 inches off the ground. What I'll oftentimes see is people want to kick straight up into the air, and that's not necessary, and that actually reduces the effectiveness of the exercise. So shoot for about a foot off the ground. You'll hold that position for just a moment and then lower back down slowly, again, repeating around 10 to 15 times on each leg. This exercise targets your quads, your hip flexors, and can build strength in the muscles that support the knee. Exercise number 3 is heel slides. So for this exercise, you can sit or lie with your legs extended. You'll slowly slide your heel back towards your butt, bending your knee back as far as possible. Hold for a little bit, few seconds, and then slide back out. Repeat 10 to 15 times. But make sure that whatever you're using, whether it's a strap, whether it's a belt, is what's doing the moving of the knee. You're not moving your knee actively. This is something that's a little bit more passive. And this exercise helps to improve your knee's range of motion and prepare it for the bending that you'll need to do post surgery. You likely don't have as much range of motion as you'd like right now, but this is a great way to start to work on getting that motion back. Because there's a lot of research to show that the motion you have before surgery, the more you have, the more you'll be able to get back afterwards. So if you've got a super stiff knee and you're not moving it at all, surgery isn't always magically going to improve that motion. But if you're starting to make progress in the motion, if you're working on it a lot before the surgery, it'll be easier to get it back after. Exercise number 4, glute bridges. For this exercise, you'll lie on your back with your knees bent and your feet flat on the floor. You'll squeeze your glutes and then lift your hips up towards the ceiling. Hold that top position for 3 to 5 seconds and then lower back down. You can repeat this 10 to 15 times. And this is super helpful for strengthening your glutes, which really support the entire lower limb. So taking the stress off the knee joint is something that can be done when those muscles are stronger. Lastly, supine knee extension. So for this exercise, you're going to lay on your back with a rolled up towel or foam roller underneath your ankle. You're going to gently press the back of your knee down towards the floor, straightening your knee as much as possible. Hold this position for 5 to 10 seconds, then relax, and you can repeat again 10 to 15 times. As this gets easier, if this is too easy, you can do what we call a low load, long duration stretch, where you set up in that position and then you just relax. You could be watching TV, you could be doing whatever, but just maintaining that position. Then you can put a weight over your leg too. But this exercise will help a lot in terms of improving your knee extension, which is crucial for normal walking and just overall knee function post-surgery. Preparing for knee surgery is one of the best ways you can set yourself up for a successful recovery. These exercises will help to build strength and maintain your knee's range of motion, giving you a head start on post-surgery rehab. As always, you need to make sure you're checking with your healthcare provider before starting new exercise routine. If you did find this video helpful, make sure and give me a thumbs up, and don't forget to subscribe for more tips on injury prevention as well as recovery. Hoping to make some more videos going a little bit more in depth about some of the post-operative instructions or information, and you'll get a notification when those come up if you go ahead and subscribe. So wishing you all the best in your knee journey recovery as well as with your surgery. And if you need anything at all, leave me a comment, send me a question. I'm here for you however I can help.